Hello friends, welcome to Cortex YouTube channel. In the last video I have discussed the concept of R factor in interpreting LFT, that it will help us to differentiate whether it is cholestatic pattern, hepatocellular pattern or mixed pattern. So using that concept, let's solve this question. A middle-aged female on polypharmacy presented with jaundice, her LFT showed total bilirubin of more 12 milligram per deciliter, direct bilirubin 4 milligram per deciliter. Obviously indirect will be 8 milligram per deciliter, and the patient's ALT, that is SGPT, is around 80 international units per liter. The normal value is 40, here it is shown. The ALP is around 480 units per liter. The normal value given here is less than 120 or up to 120 units per liter. So the question is asking which of the following drugs is most likely the responsible culprit here. So option A is anabolic steroids, option B is isoniazid, option C is minocycline, option D paracetamol. One thing is you should know R factor to solve this question, or you should know which drugs causes which pattern of liver injury. So by applying R factor here, just applying R factor, we can come to know whether it is cholestatic, hepatocellular or mixed. So let's write down the formula of R factor. R factor is calculated by patient's ALT divided by normal ALT whole divided by patient's ALP divided by normal ALP. So if you apply this formula, the patient's ALT is 40, normal is 40, the patient's ALT here is 80, normal is 40, patient's ALP is 480, normal is 120. So if you calculate this comes around 0.5. So 0.5 here, R factor is 0.5, which is less than 2. So this accounts for cholestatic jaundice, cholestatic injury. So cholestatic damage, which drug causes cholestatic, you should know. So in this given option, the drugs which causes cholestatic, let's see, isoniazid, it causes hepatocellular, minocycline also hepatocellular, and paracetamol also hepatocellular. The option that causes cholestatic liver injury is your anabolic steroids. So anabolic steroid is the answer here. So let's write down the drugs and the pattern that it causes the injury. So drugs causing hepatocellular, first I will write drugs causing mixed type of liver injury. So what about mixed? So your azathioprine, sulfasalazine, phenytoin, carbamazepine, allopurinol, and amiodarone. Remember, amiodarone causes mixed type. And last one is your fluoroquinolones. So when I say it causes mixed type of injury, they can be the causes for hepatocellular as well as causes for cholestatic. So I am not going to write them in the other columns. So let's discuss the causes for hepatocellular drugs causing hepatocellular pattern. One is your paracetamol, second one is your isoniazid, third ones are your minocycline and macrolides, like your azithromycin and all, macrolides. And one more important is nitrofurantoin. Furantoin will cause hepatocellular pattern. Here you have to remember, see, mixed can also cause hepatocellular, so I'm not going to write them. So the drugs causing cholestatic patterns, cholestatic includes your amoxiclav, trimoxazole, and chlorpromazine. and obviously mixed type of all these drugs will cause cholestatic also. So you remember amoxiclav, cotrimoxazole, and chlorpromazine. So in this, the question mentioned cholestatic pattern. So your cholestatic pattern is caused by which drug? So one more thing that I have forgotten here is anabolic steroid. Since it is mentioned in question, I didn't write here. So anabolic steroids will cause cholestatic. So steroids will cause cholestatic. Paracetamol, isoniazid, minocycline will cause hepatocellular. So the answer for this question is your anabolic steroids. Hope this is useful for you. If you like the video, please like, share, and subscribe the channel. Thank you.